All right, let's start off quickly with the event of last night, which is the first Council on Health Summit, which held, I think, at the ICC Center, and where the governor made a disclosure, more like a revelation, Ferdinand, that there are doctors who had left the state, possibly in search of greener pastures, and they were still on the payroll of the government. Can you throw more light in that aspect for us this morning?
Thank you, Wisdom. That is a fact. In the course of these all these investigations that that have been ongoing in different ministries, departments, and agencies, and the course of verification exercise and all the rest of them. So such discoveries were made to discover that some medical personnel, especially doctors, have since left the service, for greener pastures. Unfortunately, these people have still been earning salaries. So that is the essence of what we are trying to do. And of course, even without being told, that the possibility of such a thing happening, was very high. So what we are now doing is to sanitize the place. That is what the government desires of doing, and that's what Governor Leso is. Unfortunately, we are not excited about it, because we need capable, compassionate medical personnel, because the place is understaffed. When I say understaffed, I mean in terms of capable hands, in terms of people you need to be able to render the necessary medical services to our people. And like the governor mentioned, the Japa syndrome, it has become something we are all aware of. A lot of people are living because of one, poor pay, unconducive environments, insecurity of job, and all the rest of them. There are a whole lot of reasons that so you can't actually blame such individuals for deciding to seek greener pastures elsewhere. But then it is criminal for you to leave the system and still be drawing salaries, maybe could have been used to increase what legitimate workers are getting. So it's a very dangerous development. But then the most important thing is that these things have been uncovered, and the government is taking the necessary measure to sanitize the place, establish the exact number of medical personnel that are in these institutions, take care of them, and like the governor mentioned, by the time...
Let's talk about the challenge now. You mentioned it is ubiquitous across the nation. We are experiencing what we call the brain drain, where adequately educated personnel who could have been part of the success story of the nation are literally and practically leaving the nation in search of where things will be better than what it is here. What is the state government doing to ensure that these persons do not even think about leaving?
Do comparisons and see that it is better. You are not being well treated here, you are not being well paid, you are not working in a conducive environment, and of course you wouldn't have any choice than to look for greener pastures. But once you come up with programs and policies that will enable these people to enjoy the job they are doing, of course they will have reasons to be here. So that is why the government has specifically mentioned it as coming up with a welfare package in the new year. They're not talking about what will happen.
And these things are going to be practically felt by the people of the state.
Of course. That that is why we have a budget. Like I did explain, the budget we are operating at the moment wasn't a budget prepared by us. So what we rather did, even the modest job we've done in the health sector, what we've initiated in the education sector and other areas, was a creation of environment, what we call a review environment. We had to move funds from areas that were of little or no importance to areas that are of paramount importance to our people. And because you can't function outside the budget, so it's a problem. But with the budget the governor has proposed, once it's approved, in this year you will lay hand all resources and be able to work for the people. So all those working in the MDAs, especially those in the health sector, are going to be given the necessary support, the necessary encouragement, to create the necessary enabling environment to work. So they're going to get the necessary support.
Before we leave the issue of health, let's talk about the primary health sector in the state. We know that the governor, from what we've seen so far since his assumption of office, have shown his interest in terms of trying to reject the health facilities in the state, the amateur hospital where he retrofitted and all other things which was done in some of the hospital facilities in the state. How about those ones in the rural communities? Is the governor thinking of reaching out to these people, because obviously they do not have the fund to come to the state capital, to go to Aba and other places? It's going to cost them fund. But when you do the same to health facilities in their own local government areas, I mean, they will feel the impact more than not.
Okay, Wisdom, a paragraph in the speech of the governor 2 days ago reads, "We have commenced revamping and strengthening the primary healthcare system in the state and ensuring that there are healthcare workers to man such facilities across the state, just as we have resuscitated the state health insurance scheme." What we are doing is holistic. We just do not want to pick maybe Aba and here and dramatize, because just like you rightly mentioned, if you go to the rural areas, there's a large population of people, rural dwellers, and it's more dangerous for them, because when you look at the distance, from some of these communities, you know, they will cover before getting to Umuahia or Aba. Then you would appreciate the importance of having effective and functional primary health care centers at the rural areas. So we have already, you know, second record of all the primary health care centers across the 184 wards of the state. This is why you have a large chunk of the budget dedicated, you know, for the health sector. Once you get there, because see, when you continue to lose lives, there are a lot of people have lost their lives as a result of the inability to access those ordinary Fensic, Panadol, and all the rest of them. So once you have these healthcare centers equipped, you have people, that is why people, the way the government is going to operate, people are going to be posted to different rural areas, doctors and nurses. This is not the usual situation where people will want to only work in the cities. Of course, nobody wants to work in a place that he or she will not feel conducive. And that is why we are, you know, attaching so much importance to providing the necessary amenities and facilities that will make some of these rural areas conducive. Okay, if you have access road, you have water, you have electricity, and a doctor or a nurse is being paid well, there's no reason why the person would have any issues with being posted to any rural community to go and work. So I hope, like I said, a record of all the primary healthcare centers, you know, the record has been taken. I have identified areas that do not have and will have need. There are ones that are going to be merged, because this, for example, the place we are sitting here, you know, is made up out of two communities and the distance is very close. So rather than having multiple that are less equipped, you would rather have one or two that are well equipped, as long as the distance, you know, it's very close. So those are the things that have been taken into, you know, consideration to provide them all that is required to make these health sectors very functional and effective.
Abia State University Teaching Hospital. I want to show you what's happening here. All the doctors, all the nurses, I want to show you what is happening. Everybody is happy for His Excellency Dr. Alex Otti.